Saints. My name is Marianne Ushi.
Hi Saints, my name is Jeffrey.
I am Marianne Auta.
I am Bivan Tessie.
With advancements in technology, healthcare is no longer just limited to in-person visits. Today, we're discussing a topic that has revolutionized healthcare. I'm talking telemedicine. But what are the challenges and benefits of telemedicine? Stay tuned to find out. Hi Saints, my name is Marianne Ushi and this is Catholic Faith Forum. Let's go on a short break. You meet my guest right after this. Welcome back, Saints. This is Catholic Faith Forum. I am Marianne Ushi. Our topic for today is telemedicine, and I have just the right person for this conversation. Join me as I welcome Dr. Emeka Nwune. Thank you so much for coming on the show today.
It's a pleasure to be here. Thank you
for
having me.
I hope you're good.
I'm awesome. And you?
I'm good. I'm good. Okay, so who is Dr. Emeka Nwune, you may be thinking? Well, he is an accomplished medical doctor with over 9 years of experience. He has licenses in both Ukraine and Nigeria. He's the CEO and founder of Swift Medics Healthcare, a pioneering medical startup that transforms the healthcare industry by leveraging digital communication to deliver prompt, secure, and reliable medical services. They also provide free medical services to underprivileged individuals within the community. Dr. Emeka's dedication to his profession and his philanthropic efforts are truly commendable. You're doing such an amazing job. Thank you so much. All right, so today we're discussing telemedicine. It's your field, and I'm sure that you have a lot to, give to us. So just to break it down to those who may not understand it, what exactly is telemedicine?
Thank you for the question. Telemedicine, in a nutshell, is the use of digital communication technologies such as mobile apps, online platforms, and video calls to provide remote consultations, diagnosis, and treatments for people. It has really broken a lot of geographical barriers, by providing direct care to people without needing to go to the hospital. It has really changed the game, and it's here to stay.
Oh, that's nice. I mean, there's a way doctors speak. They're always so calm. Did they teach you guys that in medical school? Well,
I think it's part of the etiquette,
I see. It's the mirror. Okay, so can those in will I say rural areas, underserved communities access telemedicine?
Yeah, telemedicine is accessible to everyone. As long as you have internet, there are a lot of platforms that you can access online, and you can access through the apps. So it's open to everyone, very accessible. Yeah. So
tell us, what are the primary benefits of telemedicine?
Oh, telemedicine actually, like I said, has saved the game. It really allows people to be able to consult with the doctor from the comfort of their homes. So it means that they don't need to leave their homes, and they save money for transportation to the hospital. And it also reduces hospital waiting time, because there's sometimes you go to the hospital and there are a lot of people, and the thing you want to do at the hospital might just be a little thing that wouldn't even take so long, that you can review with your doctor or your care provider over the phone. So it really helps, for that convenience and
that
quick.
Time.
Yeah, exactly. Yeah. Okay. Telemedicine also helps with proper continuity in care, especially people living with chronic conditions like diabetes and hypertension. Because nowadays with the innovation in medicine, we have wearable devices that help track people's vitals, and doctors are able to see their vitals in real time and recommend treatments. Telemedicine
is doing a lot more good than harm.
Yeah, it really is. It has really changed the game, and it also helps with reduced hospital stays, people that have to go to the hospital to wait to see a doctor. Yeah.
So we've established that people can access it on their own, but I'm still curious about those with chronic diseases. Don't you think that their condition is so chronic that they actually need to be in the hospital? do you think that it could be better for them to just access healthcare online?
So people living with chronic conditions like diabetes and hypertension usually require lifelong treatments, require regular monitoring. And most times the problems they encounter are not being able to, in the case of hypertension, manage their blood pressure, in case of diabetes, manage their blood sugars. But with this innovation in technology, it has helped to monitor this, their vitals continuously. And the doctors can input and, make medical interventions in real time. So, like you said, they definitely need to go continuously to see their doctors, which is why a lot of collaboration is involved in case of telemedicine, where the care provider that is providing the telemedicine services is in communication with the person's private doctor, and they are co-treating the person. So in that way, it allows for more holistic therapy. Yeah.
That's good. That's good. But to be honest, is it cost effective? Is it financially advisable? Does it reduce healthcare costs, and all of that?
Well, we're talking about healthcare costs. Healthcare costs, to be honest, when we're talking about it being more affordable, it's relative because, in health can't really be cheap, right? But in terms of, looking at around the surrounding factors like transportation to the hospital, sometimes people just feel weak and they don't want to go to the hospital. It helps those kind of situations. And I think something I also missed out in terms of the importance, it also helps, for preventive health conditions, right? Preventive health, the idea is you are trying as much as possible to boost your immunity and be more proactive with your health, such that you don't even come down with sickness in the first place. So telemedicine has really helped, just like the way a lot of people use social media to promote like comedy and fun things. In this case, we're promoting health and preventive measures for you not to fall sick in the first place.
Okay, thank you so much. I'm still going to come back to that question, but we'll do that right after this break. It's time for us to find out who our saint of the week is. So over to you, Tessie.
Today we journey back to the 3rd century, talking about the life of Saint Sixtus II and his companions, whose story is one of steadfast faith, courage, and ultimate sacrifice in the face of intense Roman hostility towards Christianity. Saint Sixtus II, also known as Pope Sixtus II, was born in Greece or Asia Minor. He served as a deacon under Pope Stephen I before being elected as the 24th Pope of the Catholic Church around 257 AD. During his papacy, he faced intense persecution as Valerian, the then Roman emperor, sought to eliminate Christian leaders. Talk about power. Pope Sixtus II is remembered for his unwavering leadership during this period. Despite the threat posed by the imperial decree, Sixtus continued to lead the Christian community in Rome, administering the sacraments and guiding his people in faith. His papacy focused on maintaining the unity of the church in times of great leadership. In 258 AD, the persecution under Valerian escalated. While celebrating Mass in a catacomb, Pope Sixtus was arrested by Roman soldiers and was beheaded alongside 7 deacons present, including Saint Lawrence, who was particularly known for his act of distributing the church's wealth to the poor, before being martyred by roasting. Indeed, the heart of man is desperately wicked. Now you would think the practice of Christianity ceased after this, huh? You lie. The martyrdom of Pope Sixtus II and his deacons occurred during a time of political instability in Rome. Their deaths were meant to intimidate the Christian community, but instead, they inspired further commitment to the faith amongst Christians. Interestingly, Saint Sixtus and his companions are the patron saints for the good prosperity of grapes. And their feast day is celebrated on August 7th. They are remembered as martyrs who died for their faith, serving as a powerful example of Christian courage and steadfastness under persecution. The big question to ask yourself is, can I die for my faith? And And on this note, we ask for their intercession as we say, Saint Sixtus II and his companions, pray for us.
Thank you very much, Tessie, for that wonderful life of the saints. So back to you, Dr. Emeka. We were talking telemedicine, and before the break, I asked about the financial costs. So I feel like you're still trying to dodge the question, you know, because I mean, you mentioned it's reducing the cost of transportation, and then probably preventive, in the case of preventive medicine, where you're able to boost your immune system and then prevent any kind of sickness that you now have to pay for. But let's say you actually have the sickness. Would you say that the costs? I don't know how you guys charge, but are the charges lesser than I would get if I were to go to the hospital and pay for consultation?
Well, that's a very good question, you know, because I was looking at it from the hospital's point of view, you know, where they have to save less costs with having to deal with patients physically. Okay. But with that, I would say it might not be so affordable, like, you know, but when we check out everything involved, like transportation to the hospital, the time that you would have been using to do other more productive things, and even nowadays, like with innovation, even workspaces are bringing telemedicine to the office, where people don't have to where people don't have to skip work and lose their workforce due to certain illnesses. Yeah. So in those kind of cases, you know, the person is still working, and it's a bit more affordable compared to if they had to go to the hospital, the transportation to the hospital, the time factor that they would have lost out, the cost for like consultations in the hospital, and every other thing that would have, you know, come alongside the hospital environment. You know, even like possibly taking a visitor, like contracting something, you know, airborne or whatever as the case may be, in the hospital setting. So if we're looking at it from that point of view, we can say generally it might be slightly cheaper or almost the same, but it's more convenient and it's at your fingertips.
Yeah, I definitely agree.
Imagine like by 1 a.m. and you have to start rushing to the hospital. But imagine that same 1 a.m. you can just call the doctor.
And yeah, so it's a 24-hour service.
Because,
that's nice.
Telemedicine, like I clearly stated, you know, it can also, it mostly involves online consultations, right? Mm-hmm. So you see that cost of movement would have been saved, yeah, right? So in that case, it will be cheaper, but it might be more expensive if the person has to come to the comfort of your home to treat you physically.
But then I think that's also where the idea of health insurance comes in. You know, yes. By the time you have that health insurance, everybody wants easy life, honestly. Since my company gave me an HMO, I barely have to go to the hospital when I'm, you know, sick. Even if it's malaria, I know my symptoms, and then I just text a doctor and, you know, this is what I'm feeling and all of that, and then he prescribes drugs. Sometimes they deliver the drugs, or sometimes I just go to the nearest pharmacy to pick it up. So it shortens that hospital time, like you said. So while there are many benefits, what are some of the challenges that we can face in, you know, trying to, you know, use or implement telemedicine, especially in developing countries or low-income countries?
Well, I think the kind of challenges that we face, they're not really limited to, you know, I'll just go straight into it. Like costs, like you said, sometimes it can be a bit expensive, right? In some cases, and
even for the providers.
Yes, okay. And access to reliable internet. You know, we need, like, for those kind of situations, especially when you have to consult over a video call and you need that clarity with internet connections. Yeah. You know, we have challenges with internet here. And I would say our traditional, you know, cultural barriers, some people still believe like if they're not seeing a doctor in person, it's not the same, you know. So those kind of cultural barriers still exist. Mm-hmm. I would say challenges like language and adaptation. You know, it would be nice if, you know, we have, because we're predominantly in an English-speaking country, and most of the rural areas we're talking about don't really speak English, right? So those kind of communication challenges, acceptability, And I would say, I think these are the most common ones. So let's just leave it at that.
So costs, language barrier, and the rest of it. So there are also concerns about data privacy and security. How are you guys now, addressing these kind of issues? If I'm giving you my, in quotes, health history, or telling you what is going on with me at this point in time, how am I sure that, that information is secure and it's not going to,
Yeah, so most telemedicine platform adopts encrypted proper data protection services, and also electronic medical records. They are well protected in terms of data and privacy, which is why most telemedicine platforms also try as much as possible to educate their users on data privacy and just how to navigate certain suspicions when it comes to what they call cyber security. Things like knowing not to use a public Wi-Fi when you're accessing your telemedicine platform, and things like that. Yes, so I think how we can mitigate these kind of challenges will go about regular education, letting end users know what their data, what is being done with their data, and mostly all the regulatory bodies and licensing bodies, collaborating and just making sure you're up to date in terms of security. I feel like, to be honest, cybersecurity, no matter how we try, it might not be able to, fully have it under control. But with re-education and being more intentional, I think it has helped a lot.
Okay, so definitely both the providers and then those accessing it would have to be careful in order not to have information leaking. Thank you so much. All right, it's time for us to know our faith. So over to the KYF crew, and I'm expecting Jeff to be right there with you right now. So over to you, Jeff.
Hi Saints, welcome to another episode of Know Your Faith. I'm Jeffrey, your one and only e-catechist. Today we are diving into a topic that every Catholic should be familiar with. We're talking about fasting. Yes, fasting. I know you don't like it like that, but we're talking about it today. Specifically, we're asking, what are the different kinds of fasting you know? Fasting is a spiritual discipline that helps us grow closer to God. It involves giving up certain things, usually food, for a set period to focus more on prayer and spiritual growth. But did you know there are different kinds of fasting? Let's explore. Number one, we have the complete fast. Now, this is when you abstain from all food and drink except water for a period of time. It's intense and requires spiritual preparation. So it's not something that you just wake up one morning and say, oh yeah, now we can just run one complete fast like that. No, it requires intense spiritual preparation. Number two, partial fast, also called the Daniel fast, where you avoid specific types of food like meat, sweets, or alcohol, but eat simply meals like fruits and vegetables. Just like how Daniel chose not to eat the food from the king's court, but only ate vegetables. Soft guy. Number three, intermittent fast. Now, this is fasting for specific hours of the day, like skipping breakfast and eating only during set times. Number four, abstinence. Refraining from specific foods or activities, like not eating meat on Fridays. A lot of Catholics, or rather all Catholics, should be familiar with this. Number five, dry fast. Yeah, gang. This is the most intense type. No food or water for a short period. You guys remember how in complete fast I said you can still take water. Here in dry fast, no food, no water, but then it is for a short period of time. Now, why do we fast? Why should I even fast? I like to eat. Why should I fast? Fasting helps us, one, strengthen our relationship with God. Two, practice self-discipline and humility. Three, atone for sins and intercede for others. And 4, prepare spiritually for major feasts like Easter and Christmas. That's why we have Advent and Lent. Now let's look at fasting in the Catholic Church, right? Let's bring it down to us. Catholics observe 2 major fasts. There's number 1, the Lenten fast, which is 40 days of penance, prayer, and fasting before Easter. And number 2, the Advent fast. And now this is preparation for Christmas, though not as rigorous as Lent. Now let's look at days of fasting and abstinence. We have the Ash Wednesday and Good Friday, where we fast and abstain from meat. We have Fridays in Lent, where we also abstain from meat. Fasting is a powerful way to deepen your relationship with God and grow spiritually. So saints, no matter the kind of fasting you do, remember, it's all about your heart and intention. Don't say, hey, I want to please God, make I go do one dry fast now, one complete fast. I see you. Let your heart's intentions be very pure, and basically let your fasting also be prayer. So till next time, guys, be bold, be Catholic.
Thank you very much, Jeff, for that wonderful session. I trust your energy. You know they for my hand. Okay, back to our conversation. So the truth is that sometimes speaking to anybody over the phone, now especially a doctor in this case, can feel very impersonal. Like there's how do you guys ensure that there's still that compassionate human feel, when people are accessing healthcare via online platforms?
I think, by actively listening, and maintaining eye contact, especially when it comes to the video conversations, and, just
via text.
Well, if it's via text, I feel like the best way to go about that, by also having personalized follow-up plans, right? Where it's like, direct to that person and there are always follow-up calls. The person feels more loved or feels, like they are being listened to, right? So those follow-up care plans can help make it more compassionate. Yeah.
Yeah, I know that there's this particular platform I use. I'm not going to mention their name, but then sometimes I'm like, it's very funny, but there was a time I actually needed vitamin C. And then I text and then I tell whoever is behind the phone that I need you to recommend loratadine because I usually have allergies. I'm like, I need loratadine and vitamin C because I know what I need. And then he's like, oh, sorry, we don't. Anyway, let me just say that it's the problem of the HMO shop. But, vitamin C was just not included. And did he even say sorry? Me and people say sorry because, okay, normally you say sorry, but it just came to me like, well, it's not part of it. I'm going ahead to place your order for the one that we have. And if you don't respond in maybe like 5 minutes, they're like, I'm going to be ending the conversation now. Please let me know if you need anything. And I'm like, okay, you're rushing to go and talk to the next person. I'm still here. You haven't finished up with me. So stuff like that. I think that...
those kind of things have to do with, like the communications. And I believe, if you have any company or you have your customer has to be first. And if this kind of challenges, happen, I feel it's just a thing of communication. So I believe, the people at that point are meant to be educated on this kind of circumstances. And I feel like even with the innovation of technology, artificial intelligence and chatbots in a lot of telemedicine platforms also help people feel like, it's more personal, where they are able to ask a chatbot any questions and, also care providers in person to always be available when, these people need deeper consultations or, more personal or deeper, deeper concerns.
They really need to program those chat boxes to be human sharp. But let's go on. So how can the Catholic Church, play a role in advocating for telemedicine access, especially in areas where people are most in need of this?
I think, by raising more awareness, the church definitely has the audience. People are always listening. The church has the access. A lot of influential policymakers are in these churches. So the church can also, help advocate for certain policies that, that help in the inclusion of telemedicine. And I believe more education to the people that are going to use these telemedicine platforms and the care providers. All this are, and I also believe the church can encourage, it can also encourage public and private partnerships, which will enhance non-governmental organizations and, primary care centers and just people around to be able to make more informed decisions. So I believe it's a collaborative effort. Apart from the church, I also believe schools, our communities can also help, amplifying this message. So it's really about, the policy, adaptation, awareness.
Okay, so what's the future of telemedicine?
Wow, that's a very broad one. I mean, the future of telemedicine, I definitely propose, being able to have more languages where people can access telemedicine in more languages, I really foresee where the internet is so fast everywhere and, people are able to access telemedicine from anywhere, and then they're not really scared about the challenges. They're not scared about, limitations. And I believe if we keep collaborating and we keep, spreading the right message, the future is even closer than we think.
Yeah. I'm glad that you have this, vision. So tell us about your own baby, let me put it that way, Swift Medics. How are you guys delivering healthcare to people, and what's your unique selling point?
Of course, we have a technology where we can take people's sample from the comfort of their homes and run it in the lab and have their lab test results, and we email them the results, and we recommend treatments over the phone. We also provide easy home care access where people that have undergone a surgery or any procedure that they just don't want to be in the hospital at that time, even older people, elderly care, or people that just had a surgery or a delivery and they need a nurse to take care of them at their homes or give them treatments. We leverage those kind of situations. We also provide event medical services and ambulances for events. And I mean, for us, we try to, as much as possible, to be as holistic as possible, where we also provide a lot of health education for preventive health, for people to improve their lifestyle. Currently, we don't, but people can access us through our websites, our Instagram, and WhatsApp.
All right. Thank you so much, Dr. Emeka. It's been very educating talking to you. All right, guys, that's our show for today. I hope that, at least if you were not aware that you can access healthcare online, now you are aware. So thank you so much for watching, and thank you so much for coming on the show. I really appreciate you. All right, if you have questions or comments, do also use the comment section of our YouTube page at Dominican Media. We are also on social media at CFF on TV. Don't forget to like this video, share, and most importantly, subscribe. Subscribe, turn on post notifications so that you get notified when a new video drops. Yes. I am Marianne Ushi. Catch me on Instagram at _Marianne Ushi. So we're going to do something. We're going to say keep being saints in jeans and shirts. We're going to say in jeans and shirts. All right. So until next time, keep being saints in jeans and shirts. Bye. Thank you, thank you, thank you. So what's your website?
Swift Medics, myswiftmedics.com.
My Swift Medics. Okay, nice. Nice talking to you.